Hello everyone, Dr. Kainat here, and today we are going to talk about the treatment of respiratory tract infections, viral infections. So basically there are three main viruses that are going to infect your respiratory system. The first one is influenza A virus, the second one influenza B virus, and the third virus is respiratory syncytial virus, RSV. So we can use this drug if a patient is allergic to vaccine. So the first treatment is the vaccine to prevent the viral infection. But if a patient is allergic to vaccine, then we have to use the drugs. There are main three classes that are included in this. The first one are neuroaminidase inhibitors. The second class is augmentase, and the third one is the ribavirin. So we will discuss all of them one by one. So let's start with the first class, that is the neuroaminidase inhibitor. As the name indicated, neuroaminidase, this is a viral enzyme. That is the enzyme. The virus are going to use this enzyme to move the viron outside the host cell. First they prepare their new viron within the host cell. Now they have to move out. For that one, they are going to incorporate neuroaminidase in host membrane, and then they move out. So neuroaminidase inhibitor are going to inhibit this process. So new viron are not going to move out, and they are not going to infect the other cells. So the drugs included in this class are oseltamivir and zanamivir. It is effective against both influenza A virus and influenza B virus. The drug oseltamivir is taken orally, and it is a prodrug that have to hydrolyze in the liver first and then convert into its active form, and then it will perform its function. Where zanamivir is the active one, it's not a prodrug. So it is an active one, and it can be taken by inhalation because orally it is inactive. So we can take the aerosols. Now we have to talk about the resistance and the side effects. The side effect of these drugs are they can cause GI issues like nausea, and if we are going to take it with the food, then the issues are going to increase, like the nausea is going to increase. Second, zanamivir that we are going to take through inhalation route, they can cause what? We can use it with caution in patient with asthma and the patient with the bronchospasm, because they can cause a lot of respiratory issues. Now we have to talk about their mutation, about the resistance. So resistance can happen because of the mutation of neuroaminidase enzyme. If mutation will happen, then these drugs, neuroaminidase inhibitors, are not going to inhibit neuroaminidase, and they can't perform their function. Now we have to talk about the second class, that is adamantine antivirals, and the drug included in this class are imantadine and amantadine. This class is important because we can use it if the viruses are resistant to neuroaminidase inhibitor, but they are specific only for influenza A virus. Now we have to move toward the third class of antiviral drugs, that is the ribavirin. Ribavirin is a guanosine analog. It's a guanosine analog, so it can affect a lot of or broad spectrum viruses containing DNA and RNA. Now we have to talk about the mechanism how this drug will act. Simply, the ribavirin first have to phosphorylate and convert itself into ribavirin triphosphate, and then it will compete with the guanosine triphosphate and prevent the formation of ribavirin guanosine triphosphate, due to which capping is going to be prevented. Capping of messenger RNA. When capping is going to be stopped, it's mean RNA dependent RNA polymerase is going to be blocked. So in this way, this drug will act. Now we have to talk about the side effect where we can't use this drug. So first of all, it should be contraindicated in pregnancy. Second, it can cause dose-dependent anemia, transient anemia. And the third one, the bilirubin level is going to increase due to this drug. When we talk about its pharmacokinetics, we can take it both orally and through inhalation route. For RSV virus, we have to take it through inhalation route. Second thing, if we are going to take orally, then it means how its absorption can be increased by using fatty meals. So this is all about treatment of viral infection, or you can say treatment of respiratory viral infection. If you want to get more information, stay connected. Take care. Bye.